welcome back to the House Call community. We have a wonderful lady here, and I am so excited, Denise. I'm really, really excited that you're here today.
Thank you for inviting me. I'm excited to be here.
Let me tell you, I talk about us connecting our health dots here in the House Call community, and what I love to do is tell our listeners and our community how an individual came to sit down in the community to share with us, kind of connect that dot.
Right.
So if you'll indulge me just a little bit, I'm going to give a little bit of history here, because we have a little history.
Yes.
We both went to Loma Linda University. You were in the School of Public Health.
Correct.
And we sang in a choir together.
Yes, we directed.
We were trying to do a little something.
I was the alto.
Oh my goodness!
One of them.
Wow! And we tried to have something outside of just the books.
Yes.
And
good memories.
We had a wonderful time there. We had a great group of people that were there.
Yes.
And
friends for life.
There you go. I'm telling you, we connect people from Oakwood, from Loma Linda, and now we're all off trying to be grown people.
Yes.
Trying to do the grown folk
past
thing.
Trying. We are.
Sometimes I don't want to admit it, though.
Oh, no,
Sometimes
we
I really don't want to admit it.
We saw our parents years ago.
You're
We're
right.
at that same
You're
level.
right. You are right. We've said that before. My husband and I were talking about that, and we said we realized that we're at the age that they were at certain points in our lives, and we're like, whoa.
Yes,
they were
I was
40.
at CEC, now known as Washington Adventist University, when my mother was my age. Yes.
Wow. See, I'm telling you, but our lives connected then, and as life has it, we take different paths, and we go and do what we're called to do. And then our lives crossed again.
Yes, but don't forget, before the cross again, we also signed in a group together. Don't forget Unspeakable Joy.
Oh, you took it way back.
Yes,
oh,
I did. That was Loma Linda. That's how we really connected.
That's
it's through
right.
Unspeakable Joy.
That is so true. That was such a great ministry for
Yes,
it was a ministry for myself. And that was there were Fiona. Fiona was in there.
Fiona, Joanna, Sandra, Teslin.
Oh my goodness. Oh, see, I was an honorary Canadian, I think, at that point.
I am too. People always thought I was from Canada, but I'm actually from New Jersey because I hung out with Sandra, Teslin, and Pam. They always thought I was from Canada. Yeah.
So I tell you,
not Colleen, Heather Voss.
Heather Voss, wow, and Heather.
And Angela.
Yes.
And Angela sang with us for a little while.
You are right. My goodness. So, hey guys, hey everybody, if you're listening, if we see you there, if you see us here. We have a connection, and our connection, again, here in the Maryland area, we ran into each other at a store. Do you remember that?
Was it the ABC?
It was.
Yes. That's when I first moved here.
When you first moved here. And our lives have continually connected, and we connected again New Year's Eve at New Year's Eve service, a watch service that we both attended at a local church here. And people that listen to our podcast know that we're people of faith here. And we were just, getting ready for the new year and, just excited about what life has to bring. And we started talking.
Yes.
It's always good to
about your podcast. It sure is. We have not because we ask not.
Hello. And I found that your area of interest and passion crosses mine in a very unique way. And I've been getting requests to tackle this subject. So I said, who better to have as one of my expert perspectives as Dr. Denise Hinds. So thank you for coming and sitting down in the community.
I'm honored to be here.
We're going to talk about nutrition today.
Okay.
And we're going to talk about it in a unique perspective and the perspective you have through maternal and child nutrition. And so we're going to kind of meander through this conversation. It's going to be very relaxed. I know you said you were like, I'm excited and nervous all at the same time.
Yes.
I want people to just feel as if they're eavesdropping on our conversation at Starbucks,
Sure,
or they've been able to bring us into their home and make a house call with them, and they're able to sit down and listen and go, you know what, that makes some sense. Let me make a change here. Let me connect a dot there. So, Denise, I'm going to have you tell a little bit about your background in terms of your master's and your PhD work. Can you tell us a little bit about what you got your master's in, just very briefly, and your PhD, and then we're going to talk about your passion.
Okay.
I'm going to let you loose.
No problem. Okay. Well, my journey in health actually started in undergrad.
Okay.
I studied respiratory therapy. Originally, it was supposed to be my stepping stone into medical school. Growing up, I always wanted to be a pediatrician, mainly because I loved babies. I had no idea pediatrician was from the infant on through
to the knucklehead.
Yeah.
Did I say that out
On
loud?
through
I mean, the
adolescence.
wonderful changing of life.
Times, yes. So I love babies, and that was my reason. Everybody asked, what do you want to be when you grow up? It always had to do with being a baby doctor. That's what I thought. So I got to undergrad. Wasn't sure what to major in. I always thought pre-med was a major. I didn't realize it was just a set of classes.
Yes.
So I never really had a strong guidance counselor where career choices was concerned. So I always thought it was a set of classes. So when I got there and someone said no, I sat in it behind a pre-med advisor. I sat at the table. Okay. You know, where you try to decide
when you're going to registration.
Yes.
Right.
He wasn't there, but the person in charge of respiratory therapy was sitting there. So he said, oh no, pre-med is just a set of classes, but what do you want to major in? Why don't you try respiratory therapy? It'll be a good stepping stone. And so I thought, not really knowing better, I thought about it, said, well, okay.
Wow.
I finished the associates. Passed. I'm a certified respiratory therapy technician.
I did not know that.
So I worked in it for about a year or so while finishing my undergrad degree. And I realized I don't want to be a clinician. Because while working in the hospital, I decided I want to be on the side of prevention.
Wow. That's very deep. That's very deep. Now, I do want to ask a follow-up. Were you working with children with respiratory therapy? Or
to start, they don't have you do that. You have to work in the field on the regular floor for a while and then move. However, now that you mention it, while I was doing my rotation as a student, my favorite one was at a shock trauma unit dealing with neonates. So it was sad for me on one hand because it was sad to see sick babies and see them fighting for life, but yet it was my favorite rotation just because it was the babies.
You see, you're circling back to your babies.
Yes.
You're circling back to your babies. Now, you said something that was so profound, and I've heard it before in other clinicians talk about. You said, I don't want to be on the side of treatment. I want to be on the side of prevention. And I remember reading a book by Dr. Duke Johnson. He was a ER physician that is now doing prevention. And he wrote a book called I believe it's called The Optimal Health Revolution. And he just talks about all the different nutritional things that affect our body. And it's in that book that I first read about Nutrigenomics and Nutrigenetics. And he's talked about when he made his change was after he pronounced a 36-year-old man dead of a heart attack and had to go out in that waiting room and tell his 9-year-old daughter and his wife that he was dead. He was like, I'm done. He's like, I can be on the other side of this equation. I can be on the prevention side. So it seems like you've had that.
That was my experience. I always felt like it was an uphill battle and administering treatment. Then you have to go back a couple hours later and administer again. It's like, well, what's the purpose if they're not really getting better? It was also sad to have coworkers who were smokers. I'm like, okay, you all see what the end result is. How can you be a respiratory therapist and be a smoker?
Wow, that's
so
deep.
For me,
that's deep.
So I basically had the similar experience, maybe not on that level, although I did see a few people pass away during that time. But I just realized clinical work is not for me. Yeah. And it didn't come natural to me either. I felt like I was forcing it.
Wow.
So, but then I was confused. I'm like, well, what do? I want to be on the side of prevention. I want to help people. Right. But what I do, and I shared my thoughts with a friend at the time, and he looked at me and said, well, have you thought about public health? I'm like, well, that's what I mean. I want to help the public. And he did just what you're doing right now. He laughed at me. I had no idea public health was a field at all. That was my first introduction to public health as a field.
Like, that's
so he
what
laughed
I
at
want
me.
to do.
We went to the library. And we looked up different schools of public health, and he exposed me to what it's about. And he didn't know a whole lot about it, but he was familiar with it as a field because he himself was planning to go into medical school.
Wow.
Anyway, as we did some research and looked at the different areas within public health, because it's a very broad field.
Yeah,
so you can study epidemiology, you can study maternal and child health, health education in general. And soon as I came across maternal and child health, that was my first light bulb experience. I said, that's it. Wow. That's what I'm going to do. And that's how I ended up at Loma Linda.
Really?
To study public, yes.
So you got your master's in public health with child and maternal
and child health, correct.
And you went on
I left there. I worked for a few years for the local county in California. I stayed in California. My journey to California was supposed to be about 3 years, 2 or 3, just for school. Come home.
Yeah. Sounds like all of us.
15 years later is when I moved. Anyway, I worked for the county for a while. I ended up in a teen pregnancy prevention program. For my internship for the master's, I went to Jamaica.
Really?
Which served 2 purposes. 1, I got to know my family that I didn't get to know growing up. And 2, I worked for the Women's Center.
Really?
Women's Center for Adolescent Health, if I remember the name correctly. Anyway, that's how I kind of got into adolescent health issues. More about reproductive health, sexual health. And coming back to the States, my first job was working for a substance abuse treatment program for women with young kids. I was there as a health educator, but I focused on a lot of nutrition as well, because while there, I would see kids 8 o'clock in the morning with a Coke and a candy bar in their hand, and that was breakfast. Or
are you serious?
Sprite and Doritos. Wow. That was what their mothers gave them for breakfast. Granted, there were different reasons for that. They didn't know better.
That's true.
But nevertheless, there was a need. So I often would try to encourage health and nutrition, help balance breakfast. Wow. Then I worked for a county. I ended up supervising a teen pregnancy prevention program. So I had it just worked out that way. That was not what
your steps were ordered.
Pursued, but it worked out that way.
Man.
And I did that for a number of years. And while working for the county, as I decided to go back to school, I was grappling with, do I go to medical school or do I do prevention? Again, I still wanted to be on the side of prevention, but for some reason, because I had medical school stuck in my head growing up, it was just always there. It gnawed at me a little bit. So I actually wrestled with it. I interviewed doctors, interviewed nurses, and a lot of people were saying, go to medical school, go to medical school. You know, we need more young black female physicians. So I thought about that too, but I'm like, okay, but my heart wasn't quite there. I prayed about it. I decided not to do the medical school.
Okay.
Mind you, before I made that decision, I even went to a local community college to take calculus, thinking I might actually do the MCATs.
Oh my goodness.
So I was really struggling with the idea. Yeah. Anyway, I decided, you know what? I'm not going to do medical school, but I am going to do a doctorate.
Okay.
While working on my master's, I saw there was the doctorate of public health and preventive care. So I spoke to the director at the time about it, and he, gave me good feedback, and it was everything that I wanted. It was basically promoting health and preventing chronic diseases through lifestyle management. So I'm like, okay, this sounds perfect. Now, to a lot of people, they may think, okay, that's just kind of a general degree. You're not really a practitioner, and I didn't really care about all that because I wasn't planning to be a clinician anyway. But it's actually a very practical degree.
Okay, so this is a great transition.
Yes.
It's a very practical degree because you're able to now help educate people and give them practical tools that they can use on a daily basis.
Yes.
That will help them have better health.
Yes, and because it's a doctorate degree, I did learn more about the body. I still had to take anatomy and physiology, which the program used to combine the public health students with the medical students for that degree because it was the medical faculty that taught that class. And they still, when I was coming through the program at least, they still taught the classes for us. Yes. But eventually, I don't know what the reason is, but they separated the groups. But we still had to take the class. That is a requirement for my program. So I still understand the body on a physiological level. It's not, I don't just know general health education information. So we understand the biology behind everything as well. Granted, we may not get into that with the average person.
Right.
That's
but you
what
have that foundation.
Me. Yes.
You have that foundation.
And that's what I like about the program. It really, truthfully, there isn't a job out there with our title linked to it saying we need a preventive care person. But that's okay, because I can chart my own course.
There you go.
That's what
I love it. I love it. I love it. I love it. Now, I have been getting a lot of inquiries about nutrition.
Yes.
And people, it's out there. People want to have better health, and they know that they can either prevent or even heal or get under control chronic illnesses that they may have in their body because of what they put in their mouths.
Yes.
And so I wanted to talk to you today. We're going to look at nutrition from the maternal and child part of it. And we're going to look at maternal. First of all, we're going to talk about maternal and pregnancy, the mother and pregnancy. Do you have a philosophy? I'll start it this way. Do you have a philosophy as to there being good nutrition that a mother really needs to be conscious of when she's pregnant?
Yes, actually, it starts even before pregnancy.
I like that. To expand on that a little bit more.
Yeah, preparing your body for a healthy pregnancy.
Yes.
Okay.
Yes.
To even be fertile. In this day and age, we have a lot of women who are struggling with getting pregnant for different reasons.
Right.
And I won't say that it's connected to nutrition per se, but nutrition is very important.
Yes.
And it helps to get your body ready for pregnancy. And that doesn't mean even if you weren't and you find yourself pregnant, it's not too late to start making healthy choices.
Yes.
In fact, it's paramount that you start making healthy choices if you were not making healthy choices before. So, but my philosophy with nutrition and pregnancy is actually to develop a healthy lifestyle, healthy eating habits before pregnancy.
Yes.
To have optimal outcome.
Yes. I'm so glad you said that, because my field is obstetrics and gynecology, and we're seeing the age for women of childbearing age to actually increase with their first pregnancy. So we do have women that have other comorbidities like hypertension, diabetes, asthma even.
Yes.
We're starting to see, what are they called, autoimmune diseases that people already have before they get pregnant. So their pregnancies are starting off high risk, is what we would consider.
Right.
And so you're basically preaching to the choir here. I mean, I would say it all the time in the office when women would come to me and have the presence of mind to start talking to me before getting pregnant.
Right.
And saying, well, what do you think I should do? Well, let's go to the basics. Let's talk about your water intake. Let's talk about decreasing that sugar that you're putting in your body, because you want to partner with me to have a healtzy outcome.
Starts now.
But I need you to be a healthy host, as healthy as you can be.
Yes.
As healthy as you can be. So what advice would you give a woman that comes in that says, I'm thinking about getting pregnant. So let's start there. Let's start prenatal. I'm looking at getting pregnant, and I want to make sure that I do everything I can. I know that's a big broad brush.
Right.
But what are just some bullet points you could give her?
There's some basic nutrient needs that you want to be mindful of.
Okay.
One, get plenty of folate or folic acid.
Yes.
That's important, as you know, for cell development.
Yes.
And preventing neural tube defects.
Yes. So
it's important to get as much folate. Yes, you can do a supplement. Supplements but I would say use supplements to fill in the gaps. You want to get your nutrients from your food.
Yes.
Plant-based foods are where most of the nutrients are. I know sometimes it's hard for people to keep up with numbers. How many milligrams of this, or how many calories of that. So I say when you're planning your meals, looking at your plate, think in terms of color.
Okay.
Because then you'll then guarantee that you're giving your body as much nutrients as possible.
So when you say think in terms of color on your plate,
all different colors on your plate. Have the reds and the yellows and the purples and the deep green. One of the reasons why green smoothies are so popular, They're like your one-stop shop for nutrients.
Really?
Deep green leafy vegetables. You can get your vitamin C, your calcium, your iron, in addition to other antioxidants and fiber. So that's why people, green smoothies seem to be the buzz more than anything else. But you don't have to just do green smoothies. There are others, but just think in terms of color.
I like that. Think in terms of color on your plate. So
the more color, the more nutrients you're giving yourself.
Got it. So I'm looking at a big healthy green salad, or
which is the perfect example, because you can put just about anything goes with salad, really and truly.
There you go.
And not just with vegetables, but you can also put your beans in there to get more protein. Protein, you can also get protein from your leafy greens. So it's like your one-stop shop.
You can get proteins from leafy greens.
Think about it, the biggest mammals on earth, you hear people say it all the time.
That's right.
Eat a lot of greens.
That's true. So we're kind of debunking some myths here too, a little bit.
Yes.
You can get your proteins from, I knew legumes can give you proteins.
And your nuts.
But also from your greens.
Some level from your greens, yes.
Wow. So you're the woman is coming in, like we said, she's saying, I want to make sure I'm the healthiest, and you just telling her, let's just do some practical things. Let's start with our plate. Let's look at the color of our plate.
Let's look at the color. Put lots of color and even the portion sizes. So there's many websites that will tell you what a balanced plate looks like. Half of your plate should be your fruits and or veggies, which multicolor, okay?
Half of my plate.
The plate.
Okay.
Half of the plate.
Yes, ma'am.
Another quarter of the plate would be your whole grains.
Okay.
And by whole grains, it could be brown rice. It can be barley, quinoa. Now, quinoa is a complete protein. That's another good source of protein. Other items that you can get protein, like your rice and your beans, you really need your rice and your beans to get a complete protein, which, by the way, doesn't have to be in one meal. You can have your rice at lunch and your beans at dinner time, and at the end of the day, you've consumed your complete protein. But quinoa is a complete protein.
Really?
Yes.
That's one of those
all the different
that's kind of
amino acids
emerging.
that make up protein. Yes. So quinoa is one of those foods. Quinoa and the edamame bean are complete proteins. Everything else are a portion of protein that you would need to combine with others to get a complete protein. But quinoa and edamame beans, also known as soybeans, one type of soybean.
Okay. Are you guys are taking your notes, right? I know you're going to go back. Like I always say, there's so many nuggets that are going to come out of this conversation that you're going to just go writing down. Like, okay, wait. Let me go back. So we've talked about the lady that comes in before pregnancy. Now, go ahead.
If I finish the plate, I want to finish the plate.
Yes,
so we did half of the plate,
I'm sorry.
your fruits and or veggies. Your other quarter of your plate would be your whole grain, and the last quarter would be your protein.
Okay. So half of the plate
is your fruits and or veggies, plant-based. Well, it's all plant-based, really. For those that are vegetarian, it would be all plant-based.
Okay.
For those that are not, half of it should still be your fruits and or veggies. A quarter of it, your whole grain, not refined, whole grain, and the other quarter would be your protein.
Wow.
Many restaurants, it's the other way around.
Yeah.
Half of it would be the protein.
Exactly.
And maybe 3 stalks of carrots or 3 stalks of
like asparagus.
Yes.
that's the new green. It's like, asparagus. Okay. Wow. So now she's pregnant. She's come to me now, and she's pregnant. And I used to hear this a lot. I'm eating for 2.
Yes.
And I would,
theoretically you are.
Right.
But physically you are not.
And I remember one patient in particular, her story stands out to me because she was very, her physique, she was almost like a runner, an athlete. And she said, in college, that's what she did. And when she had her first baby, when they got pregnant with their first child, she gained 60 pounds. Ooh. And she said she was just in that, mindset, I'm eating for 2, I can eat whatever I want.
Wow.
So she was like, I ate donuts, I ate whatever craving, and I was just like, are you serious? Because now I'm in her second pregnancy, and she's, very not rigid to the point where I'm concerned about her getting nutrients, but she's on what we call the curve. She's not gaining too much. The baby's growing appropriately. Before she got pregnant, she had lost the 60 pounds, and she was just telling me, I'm just going to make sure that I don't fall back into that rut. And it was a healthy mental attitude. So what would you, how would you guide a mom through pregnancy? Because we know that the nutrients nutrients goes through the placenta, goes through the umbilical cord, and that's how the baby does grow throughout the pregnancy. What are some tips for a mom in pregnancy? And then we're going to move on to after and delivery.
So you don't have to eat more food per se.
Okay.
At least not twice as much. Your nutrient needs, your needs would probably be about maybe 300 to 500 calories more.
Okay.
Which isn't a whole lot more than what you're already doing. So you still have the same nutrient needs. You want to get your folic acid. You want to get your vitamin C. You want to get your vitamin D, which the body produces on its own.
Right.
You just need maybe 10, 15 minutes of sunlight.
Yes.
So you have to be careful because I know sometimes if you use a lot of sunscreen can block that from happening. But get your 10 to 15 minutes of sunlight, then put on the sunscreen. Okay? You want to keep your plate balanced the same way.
Okay.
So the same nutrient needs. You don't have to change. Same balance.
See,
just a few, maybe a larger portion of the whole grain, or actually I wouldn't even go with the whole grain, just a larger, more of the fruits and the veggies.
There you go. Because that's
and your snacks, if you're having snacks in between meals, keep them healthy, balanced snacks. Either your nuts, which is low. Nuts alone would give you that extra calorie needs.
I was just about to say,
a quarter cup of nuts.
That's your extra 300.
Roughly. That's your extra 300 right there. Dried fruit, if you don't have issues with diabetes or anything, because dry food is concentrated sugar.
That's a good point.
Or just fruit.
Yes.
Because fruit, you get the fiber and the sugar. A lot of people want to shy away from fruit or dried fruit even because of the sugar content. But that's usually if you also eat a lot of refined foods and a lot of refined carbs. Okay. The good thing about eating fruit versus fruit juice, which if you're going to drink juice, it should say 100%. But it's better to eat the fruit because you get the fiber, which actually helps control the glucose level and the rate at which your glucose level spikes. So if you're having whole foods, it won't be as much an issue.
See, I love this. I love this. So, again, debunking some of these myths where I'm eating for two, I need to have whatever I want, the cravings of, increased refined sugars, but just making sure that we, again, have that balanced plate.
We need a balance, yes.
And understanding that increased caloric take is mainly just another serving of something.
Of a food item.
Of a food item.
Yes.
That's it.
Food item.
Wow.
It's, as far as exercise, because you mentioned you had a client that was exercise. If you exercise quite a bit, that's okay to maintain. I know a number of women who, because they were athletes before, they even ran while they were pregnant.
Yes.
But if that wasn't you, pregnancy is not the time to start.
I'm so glad you said that.
Just walk. Walk is the best exercise. So just walk or do things. So it's not too late to start exercising, but you don't want to do what you haven't been doing prior to pregnancy.
That's such a good
You
point.
mentioned with the food, you are getting nutrients for two. However, the calorie needs are just one serving, as we mentioned, but make sure it's balanced.
Okay.
Because during pregnancy, the fetus, it's set up so that the nutrient needs of the fetus takes precedence. They're going to get what they need regardless of what you eat. So if you want to you can go ahead and have your donuts and your cookies if you want to, but know that the baby is still going to get what he or she needs.
Wow.
Meaning, if you aren't eating enough, if your meal isn't balanced enough where you're consuming a proper amount of calcium or a proper amount of iron, the baby's going to absorb it from you. Meaning from your bones or from your teeth, which puts the mom at risk for dental
issues,
or eventually osteoporosis or something. So the nutrient needs of the baby will be met more often than not.
Right.
Regardless. Right. So it's important for you to think in terms of getting as much nutrients from natural sources as possible. Now, there are some, and if you're a vegetarian and you want to take supplements, there are some vegan-based supplements out there, but use the supplements to kind of fill in the gaps, just to kind of make sure you're getting enough. Most of your nutrient sources should be from the natural foods.
From your foods. Yes. I like that. I like that term that you keep saying, just fill in the gaps. Because we should be having, like you said, we should be getting our whole foods. We should be getting that balanced diet. So we will have some gaps. I mean, life just happens.
It happens.
And I like that term that you just fill in the gaps. I love that. So guys, think about that. Remember that. And, you know, going back to exercise, I had another patient that I remember who, you know, she was avid exerciser before. And she said, you know, people are telling me not to exercise during pregnancy. You know, what do you think? And I was like, no, absolutely. Because we do know that if you exercise, you're increasing the blood flow to the placenta. You're increasing the blood flow to your muscles.
Nutrients,
the nutrients,
oxygen,
everything. And we know that it actually helps with labor. Your labors are not as long. And she's like, really? I said, now don't overdo it. You you can't, like you said, you can't overdo it. And but if you, like you said, if you've been exercising before, continue. But I always say something like, you know, maybe dial it down. Yes. That's it. Just dial it down. Another story. I tell you, all these stories are popping in my head. I was doing a aerobics class at one point. And the instructor came in after we were all kind of getting our steps and putting our steps in order. And I didn't see her walk in, and I looked up, and her back was to the class. She turns around, and I go, she's pregnant.
Right.
And the lady beside me said, oh, don't let that fool you.
And made it happen.
She's going to work us out. She said she's going to stay at her level, but she's going to make sure we sweat. After the class was done,
you found respect.
I had to go. I said, I need to shake your hand. I really do. Because on two levels. One, you worked my behind out. Two, I'm an OBGYN. And how many weeks are you? She was like, oh, I'm 36 weeks. I said, you're what? 36 weeks. And she kept hydrated. She walked. Right. She stayed on her level because she knew at that point, hopping up on a step, you lose your balance easily. But I had a newfound respect for her. And like you said, just from our practitioner standpoint, unless you've been diagnosed as a high-risk pregnancy and you're not supposed to be doing certain things because of other medical issues, but if you can still get out there and walk, if you can still get out there and maybe go on a treadmill or something, keep moving. And we now know that diabetes in pregnancy is a risk factor for children becoming diabetic. So now we're going to move into the next phase. And I know you have a passion for maternal and child nutrition and health. How do you start teaching the moms to help teach their children now about nutrition?
You know, I don't have kids of my own, but I've watched many kids. I have friends with kids. So I'm always working with kids at some point. And one of the things I've learned in observation, if you involve them in the meal planning or even the meal preparation, they will eat it.
Yes.
They will eat it and they will enjoy it. Yes.
I took your advice the other night, and we were having string beans and sweet potatoes, and they came in, and usually I'm a little frantic at that, dinner time, like, just give me a minute, just let me finish. And I said, you know what? Denise said, if I involve them, I took a deep breath. I let them put on their aprons because they had gotten their little cooking badge from Adventurers, so they had their aprons. And they helped me snap the beans. They helped me stir the beans in the stir fryer. They helped me, Skylar helped me to peel the sweet potato. And
just to guide them,
and
just watch.
Dinner was not an issue.
Not at
I mean,
all.
they're not big. They are big vegetable eaters anyway. But sometimes they can get a little. Oh, I don't want that tonight. They were like, these string beans are good.
Yes.
I was like, touchdown, Denise.
I had a similar experience, and we just had a simple spaghetti dinner. It was whole grain spaghetti, mind you.
Okay.
We had one party making the spaghetti, 2 kids, very picky eaters. The other wanted to help with the sauce, so I had her, I chopped up the onions for her, and then we put them in the pot, and she got to stir and saute the onions and the peppers and add the sauce and the seasonings. And then they both helped with putting together the salad, which they generally don't like salad. But by the time we got done making our salad and our pasta and the sauce, all I could hear was, this is the best spaghetti dinner ever. It was just a simple little meal.
Wow.
But because they made it, they enjoyed it.
Wow.
Even more
Yes.
than they have times. They like spaghetti in general, but because they were part of the process, they enjoyed it.
Okay. So I had a mom to send me a question on Twitter, actually, before you came, and she said her children are fairly healthy eaters. They don't mind the vegetables and the fruits, but she has another friend who said, I see how your children love the fruits and vegetables. How do I start transitioning my kids? Because we didn't get that healthy nutritional start, and I want to help them to transition. Do you have any little tips?
For the transition, actually the word you just gave, transition, which means if they're used to eating, let's say you give them 2 bags of chips for lunch, give them maybe 1 bag of chip and 1 bag of baby carrots or something of their choice. Let them have a choice, because that's the key. When they have a choice in it, granted, it may not always be practical. I understand, because I can hear a lot of parents saying right now, look, what I put in front of them, they're going to eat. I get that. Yes. I completely get that. But as much as possible, have them be a part of the choice, the choosing, the meal planning.
Even for lunch.
Right. And even if you take out the chips and the cookies all together, then give them a choice. Okay, we have apples, we have some carrots, we have some of this. Choose which 2 you want, or choose which 3 you want in your snack bag.
I like that.
Because if they choose it, chances are they're going to eat it. So make it a trend. You have to do it in phases. Okay. It's just like changing our own palate. We might not. It's kind of hard from going from something you're used to eating to just switch.
And we try to do that all the time.
To do it, and then we say, forget it. It's not going to work. You got to do a slow transition, little by little changes. Wow. And I think one of the things with kids, involving them as much as possible, reasonably possible, it helps.
Wow.
Let them cut their own apples if they're age appropriate.
Okay.
They have baby carrots that you don't have to cut already. It's already done. So that's one of the suggestions I would have.
Wow. For that. Thank you so much. I really appreciate this. Denise, I know that your passion is going out there and teaching and helping people to understand, like, these very practical tips. I love it. Just practical everyday tips. Like I said, I took that one tip, we talked about the other night, and was able to implement it immediately and saw a difference, saw a change. As we continue on our journey, throughout life, as we continue on and we have some chronic illnesses sometimes that pop up, what type of basic nutritional advice would you give somebody that may be dealing with, I know there are all sorts of different chronic illnesses that, we could give specifics, specific recommendations to. Right. But is there something that's kind of like overall general health that you can think of nutrition-wise that everybody could, benefit from? Sure.
First, I want to say, having a healthy diet or balanced diet doesn't mean you'll never get sick.
That's a great
Because that's one of the things people think, well, why am I sick? Or why eat healthy? Because look, she eats healthy and she still got sick. It doesn't mean you'll never get sick. I mean, we live in a world air pollution and all kind of insanitary environments.
Yes.
So sickness may happen. The whole idea of eating a healthy balance is to, one, prevent it as much as possible.
Okay.
That's a given. You do prevent it as much as possible. And two, it promotes healing as much as possible in the event that you do get sick.
I like that.
Someone with a balanced diet that catches a cold, maybe it can be done in a day or two, where somebody else can be down for a week. So it promotes healing, faster healing, and more, what you could say, complete healing.
Yes, yes. I like that. I'm so glad you brought up that point, because in the book that I was talking about, Dr. Duke Johnson was talking about nutrigenetics. And actually, not nutrigenetics, nutrigenomics. I'm sorry. The term I want is nutrigenomics. And it is how what we eat affects the DNA and the cellular level, affects it all the way down to the cellular level. And like you said, it can help repair DNA.
Yes.
It can help repair the holes in the cell membrane. It can help
set it up. You set yourself up for a good fight.
I love
it. It's training.
That,
I like that. You don't just go to war cold. There's a training process so that in the event that it actually happens, you are prepared for it.
I like that.
So you're preparing your body to deal with any environmental issues that you may have. So eating healthy is more about prevention and faster healing. Now, many people may say, I'll eat what I want, but then when they actually get sick, then all of a sudden health becomes important, and then we want to start juicing and doing and all of those things are good. I'm not, they're all good, but it would have been better. Just like the cliche or the quote says, an ounce of prevention is better than a pound of cure. Because now you have to work double time in illness. If you wait until you're sick to do something about it, now you have to work overtime, and it even costs more, because juicing is expensive. You only get so much juice from a single fruit, so you need a lot of it to get the power pack, the amount of nutrients and things that you need.
That is a great point.
So another myth, people say, well, eating healthy is too expensive. Yes, sometimes produce may cost more than $1 burger, but in the long run, it's actually not.
Yes.
Because you end up spending less on medical bills.
Hello.
As one person put it, it's cheaper than cancer.
It is.
So while it may seem more expensive on the front end, it's actually less expensive on the back in the long run.
I like that. Denise, this conversation has been absolutely wonderful. I have had a ball.
And we're just scratching the surface.
I know, and that's what I love it when somebody comes in and we scratch the surface, because I want you to be able to come back.
Absolutely. I'll be happy to.
Thank you so much. But I'm looking at our time, and we do need to wrap things up.
Okay.
And we usually have our guests give our community a tip of the day. And you kind of already done that in this last few moments. But if there's something else that you can give our community a tip of the day.
I'll mention one other thing, because you mentioned earlier you encourage your patients or your clients to hydrate themselves.
Yes.
Your pregnant women to hydrate themselves. One of the things, there's a lot of, sometimes people wonder, well, how much water do I drink? Is it 8 ounce glasses a day? Okay. Sure, that sounds good. Other sources may say half your body weight in water. That's a lot, depending on how much a person weighs, and you don't want to send your electrolytes off balance. So a good rule of thumb for hydrating yourself is enough to keep your urine clear.
I like that.
If your urine is clear when you go to the restroom, then you're probably drinking enough water. You can maintain. So if in drinking 6 cups a day keeps your urine clear, then 6 cups is enough. You don't have to do 8. If you need 8 to keep your urine clear, then by all means, drink 8 cups. The rule of thumb, enough to keep your urine clear. With the exception, keep in mind whether or not you're taking supplements, because usually when you take vitamin supplements, it will be concentrated. So you have to take that into consideration. But even then, you're only taking 1 a day. So if you're drinking your water regularly, then it should clear up eventually.
I like that. Thank you so much, Dr. Hinds. Thank you so much.
You're very welcome. I'm very happy to be here.
And with that, community, we'll see you here next time. Bye now.